Pregnancy is an incredible journey, filled with anticipation, joy, and a whole lot of changes. As your body nourishes and grows a tiny human, it goes through remarkable transformations, both physically and emotionally. Amidst the whirlwind of preparations and doctor's appointments, it's important to remember that your well-being is paramount. One aspect of prenatal health that often gets overlooked is bone health. We often associate strong bones with growing children or aging adults, but did you know that pregnancy and breastfeeding can also impact your skeletal system? Understanding the relationship between motherhood and bone health is crucial for ensuring both your well-being and that of your little one. By taking proactive steps to support your bone health during this transformative time, you can lay a strong foundation for a healthy future for both you and your baby. Let's delve into the fascinating world of bones, hormones, and the incredible ways in which your body adapts to the demands of motherhood. During pregnancy, your body undergoes a remarkable transformation. Hormonal shifts occur, blood volume increases, and your metabolism goes into overdrive. These changes require a significant amount of calcium for bone health. Your baby needs calcium to build their skeleton, drawing from your bones if necessary. This ensures your baby gets the nutrients they need. Most women regain lost bone mass within a year after giving birth. Breastfeeding is a beautiful way to nourish and bond with your baby, providing them with essential nutrients and antibodies that support their growth and development. But did you know that breastfeeding can also impact your bone health? There's a common misconception that breastfeeding depletes the mother's calcium stores, leading to weaker bones. While it's true that breastfeeding requires additional calcium, studies have shown that breastfeeding actually has a protective effect on bone health in the long term. How does this work? During breastfeeding, your body releases the hormone prolactin, which stimulates milk production. Prolactin also appears to have a bone-preserving effect, helping to maintain bone density even when calcium intake is slightly lower. Furthermore, breastfeeding is associated with hormonal changes that promote the return of menstrual cycles. Regular menstrual cycles are important for bone health as they help regulate estrogen levels, which play a crucial role in bone maintenance. Essential nutrients for bone health. Prioritizing bone health is crucial, especially during pregnancy and breastfeeding. Calcium is vital for bone strength and density. Vitamin D aids in calcium absorption. Spend time outdoors or consider a supplement. Protein is essential for building and repairing bones. Magnesium helps regulate calcium levels. Section 5. Practical tips for expectant and new mothers. Here are some practical tips for supporting your bone health during pregnancy and beyond. 1. Prioritize a nutrient-rich diet. Focus on consuming a balanced diet that includes plenty of calcium, vitamin D, protein, and other essential nutrients. Talk to your doctor about any necessary supplements. 2. Stay active. Engage in regular weight-bearing exercises like walking, jogging, or dancing. Exercise helps strengthen bones and improve overall health. Always consult with your doctor before starting any new exercise program. 3. Get enough sun. Spend some time outdoors each day to boost your vitamin D levels naturally. Remember to wear sunscreen and avoid prolonged sun exposure, especially during peak hours. 4. Limit caffeine and alcohol. Excessive caffeine and alcohol consumption can interfere with calcium absorption and negatively impact bone health. 5. Talk to your doctor. If you have any concerns about your bone health or need personalized advice, don't hesitate to reach out to your healthcare provider. Section 6. Building strong foundations, your bone health journey. Motherhood is a transformative journey that brings immense joy, love, and a renewed appreciation for your body. By understanding the impact of pregnancy and breastfeeding on your bone health, you can make informed decisions to support your well-being during this special time. Remember that prioritizing your health is not selfish. It's an investment in your ability to thrive as a mother and be there for your little one for years to come. Embrace the journey, nourish your body, and cherish the incredible strength and resilience that comes with motherhood. By taking proactive steps to support your bone health today, you're building a strong foundation for a healthy and vibrant future for both you and your family.